It makes me very happy. Um, so quick introduction, guys. Um, Tonight is a very special stream. We have my boss, nurse practitioner Milan here. She's going to lead us in a really great discussion about functional medicine and weight loss. And no, guys, it's not too late to, make New Year's goals. I've said this before. Me personally, I feel like I use the astrological New Year more as like my New Year thing. But we're going to kind of like dig deeper into weight loss and, maybe help people if they need some tips and stuff. But really just talk about, how functional medicine can affect your weight loss goals, weight management, what functional medicine is. A lot of you guys were not here when we first started doing these streams, but they're a lot of fun. And and Mela, no, I'm not leaving. I'm here. Um, and very informative. I always love these streams because I learn a lot and we get to share. But just to reiterate, guys, this is just for educational purposes. As always, we recommend you. Wow, a sugar alien. Look at that, guys. All right. Well, maybe we will discuss some of the things that you did. That's okay. All right. That's amazing. Yes. Okay, so without further ado, I want to bring on our very special guest. We have nurse practitioner Dr. Milan Chavakar, bringing her in right now. All right, I think you just have to unmute yourself and then you'll be good. Hi there. Hello again.
Hello again. It's been a long time.
Very.
Oh, your mom. I just love her.
My mom is here. My sister is here. My amazing community is here. A lot of these women have been with me since I've started, and
Hello.
the
Oh,
rest are all very close and dear to me. So thank you guys so much for being here. Um, how about your day? How was your day?
number wise, I started the day with headache. So
I know.
you're asking me live how I no, it probably at a 7 also. 6 to 7. It got to a 7. Being on this thing is making me an 8, I think. I mean, this is school, being back on Twitch with you is you're such a pro and so natural at this. I love it. I'm so glad you made a decision to keep streaming. You really
Thank,
are talented.
thank you, thank you. Thanks, guys. Well, I wouldn't be here without the support from the fellow streamers and the chat. So thank you, guys. I'm a little out of focus. I forget how I fixed this last time. I don't know. We'll see. Thank you. So why don't you go ahead and begin by just telling us a little about yourself, your background, and about your practice?
Yeah. So I started as a nurse and I started counting the years because I'm forgetting. It's been 26 years as a nurse and 25 years as a midwife and 21 years as a nurse practitioner. So
Wow.
I've done quite a bit and I have done the whole gamut in medicine and decided, you know what? I want to do something different that really, really truly helps people and heals people, helps people heal from within, and found integrative and functional medicine. And wow, and we already heard a little testimonial from somebody who looks like who's already tried functional medicine. And I am just, and you've been working with me for a couple of years now,
Mm-hmm.
and we have seen some pretty incredible changes in people's health using functional medicine. And I just love it because it's a different way of really, it's a different way of approaching health problems. And it's a really holistic way. It's more support and, just really understanding the root cause. So, and when you understand the root cause, you can actually change it at the root cause level and impact healing and health in a really long-term way, rather than sort of the way we deal with things now, which is sort of like, here's a little band-aid, or here's a pill. So I really love what I'm doing now. You know, I think you love it too, because we get to help people in a really much more profound way. So it's been, my joy over the last couple of years to do this kind of work.
Yes, I had no idea what functional medicine was before you and I spoke about it for the first time years ago. But for those who are not familiar with that term, functional or integrative, would you mind kind of explaining exactly what that is?
Yeah, so, basically, integrative medicine is a type of medicine where we use ancient traditional medicine like Ayurvedic medicine, our Eastern medicine, traditional Chinese medicine. We use herbs, supplements, we look at things in a more natural way. And we combine that with sort of conventional medicine, which is our tech heavy, our big pharma type of medicine. Functional medicine is sort of a different branch of that, where we're not only using lots of different traditions for healing, we're also looking at testing at the cellular level and understanding what is the dysfunction, uh, at that lowest level that's impacting health overall, cells, organs, health systems, body systems, where you're looking at it in a way that's more holistic. And we're doing testing to understand what's happening and how we can provide interventions for that. So again, it's called like root cause medicine. So functional
Mhm.
medicine is sort of a different approach within integrative medicine.
Yes, guys, it's very interesting, especially right now since a lot of people of all ages now, it's not only the youngins. We're all on social media and we're just being fed so much different information through the internet. And I remember, like, back when Facebook started to get a little wacky with different things here and there, and now it's like it's just there all everywhere. It's on Instagram, it's on TikTok, feeding us information. It's hard to differentiate between, what's true, what's not. And, obviously, like, we should all be checking in with our primary care doctors, but some people don't. So it's interesting how, like, providers like yourself have gone on to social media and whatnot to kind of share these new ways of medicine, or these alternative ways of medicine, whatever you want to say, but something different than the conventional way, because it's kind of opening some of our eyes to knowing and asking more questions and whatnot. And don't want to say that it's a fad, because I think it's a good thing that a lot of like us are questioning, our diet habits, our we're able to learn and share information, but that could be like a good thing, but it could also be a bad thing. We can't obviously like listen to everything that we read and hear and see on the internet, but um, it's interesting to find out that there's so many different ways to approach medical issues, anything that is not making you feel well. So I love working in this field, because I think combining, the traditional, but also introducing some older like ways of medicine that have been around for years and years and years, herbs, supplements, and whatnot, um, is very, very interesting. And I think it's great that we have a platform to share, what is out there right now. But so I have the really fun job of working on our social media. And I love it. I love learning, um, a lot of things from you, Milan, and about the topics and whatnot. But what we like to do is we like to highlight different topics or themes for the month. So for this month of January, January being the first month of the calendar year, everyone, is doing their New Year's resolutions and whatnot. A very popular one being getting back to exercise, eating better, and ultimately trying to lose weight. It's still around. We're still all trying to do that. And it's great. What I like to say is you don't necessarily need the new year to, jumpstart weight loss. But is definitely a good time to, start off the year healthy and whatnot. But we've been discussing and posting a lot about how functional medicine can assist in weight loss. Um, so we've like kind of I've learned a lot from you already. I think like an hour of everything that I just learned from you is like not enough, but we're definitely gonna like touch the surface of it. But one thing that I wanted to ask you, if you could explain to us, because you are a nurse practitioner, what is kind of the difference between a nurse practitioner and um, a doctor?
So I get that question a lot because I'm also a doctor because I have a doctorate in nursing. Uh,
Hmm.
so doctor can be used, the term doctor can be used for anybody with a certain level of education. So if you have a doctorate, meaning you have so many years of education, you can have a doctorate in optometry, you can have a doctorate in physical therapy, you can be a doctor of chiropractic medicine, you can be a naturopathic doctor. So there's lots of different doctors. Nurse practitioners can also be doctors because you can have a doctorate degree. And that will be the requirement soon for all nurse practitioners. At a minimum, nurse practitioners have a master's level education in nursing. And we practice through our training is a nursing foundation training, and we know what nurses are. Nurses are caring health professionals. They have the heart and the mind. That's a lot of the stuff I read online. Oh, nurse practitioners have the heart of a nurse and the mind of a physician. And I typically call doctors what we normally think of as a doctor is a physician or a medical doctor, and they have different training than we do. They use the medical model, we use the nursing model, and we have a lot of the same knowledge. We do a lot of the same work, but we're using our philosophies of care based on the model of education we've had. So I use nursing as my model. I love being a nurse. I worked as a nurse first and then became a midwife and a nurse practitioner. And to me, nursing really is the ultimate health professional. We're the most trusted health professionals in the country year after year after year. And we truly use a holistic model where we incorporate, psychology, sociology, the psychosocial situation of somebody. We're looking at mental health, family systems, not only just physical health. And I think that translates really well into functional and integrative medicine because we really are looking at people from a holistic perspective. And I'll give you an example. If you want somebody to come to your office every month and they don't have a car and they have to take the bus, sometimes I've noticed some providers can forget that people have a situation at home which may not allow them to do some of the things that we've asked them to do, whether it's come to visits or take medicines. And so that's an example of how thinking a little bit broader about how we deal with a patient is helpful. And I'm not saying that other providers don't do that, but I know as a nurse, that's kind of our training. So that's sort of the difference between from a medical perspective. I still diagnose, I still treat, I write prescriptions. I'm allowed that from the uh, board of nursing, legally allowed to do that. And in California, we are required to still work with physicians. So it's not that we're out here doing anything crazy. We're doing very much the standard of medicine. So I just think it's a different kind of different approach, and I love kind of combining nursing with um, functional medicine. I think it works really well.
Oh, we have Betty here. Thank you for the resubscription, Betty. Welcome back from vacation.
I think
Awesome.
I see my friend Brandy might have joined us, I think.
Oh, is that Brandy?
Yeah, creativity is my superpower.
Oh, there she is. Hi, Brandy. We got to get you back on here, Brandy. Hopefully soon. Oh, she's the sweetest. Oh,
Great.
yay. um, well, thank you for joining, Brandy. So let's go ahead and start. I guess you're gonna speak a bit about weight loss and how functional medicine can assist in weight loss. A topic that
Oof.
never gonna go away.
And the sad thing is, it's not just in America, it's all around the world.
Mhm.
I was trying to come up with some statistics for tonight just because I think we all know weight is an issue in America, and we know a significant portion of Americans are obese or overweight. I think, some of us are content with it. So I wanted to see how many people are trying to lose weight. I think the statistic, I forgot the statistic on how many people are overweight, but I think it's like 75% of America is overweight. But
Mhm.
55% of us are trying to lose weight. And we have tried 126 different diets, and
Yeah.
only 5% of us will be successful. Talk about a depressing statistic. We're all going to be sitting here trying, and only 5% of us will actually lose any weight.
I think about it all the time. I think about it all the time.
And I think the reason, when I hear 5%, oh, I love that. The weight doesn't want to lose me. I think that is so classic. That's how I feel sometimes. I mean, I also struggle and have struggled since I was a little kid with weight. And I just the hard part is everything is against us. And we think of it as, I think we have all been really indoctrinated with this guilt and shame over our weight. And I really want to let that go, because we feel like if we're not eating right, we're not exercising right, we're doing something wrong. And really, if we think about it, the odds are stacked against us. And I'll tell you why. We're all on the computer more. We're not running around outside hunting or gathering for food. Our food systems are, look at our farming practices, the lack of, we're using all these toxins when we farm. We have organic foods, but the soils probably has toxins in it from before. We have processed foods everywhere. We're busy. We're on the go. We don't have time to cook and make something healthy. Um, the nutrient value in our foods, whatever they are lower. And like I said before, toxins in the soil, toxins in our food, but we haven't even talked about pollution, toxins in our air. And then my newest thing is electrosmog, all the electronics and how they're affecting our cells and how they work. So here we are in this environment, and it's all against us, because guess what? All of those things contribute to weight. It's not just in our power. Because let's face it, if 55% of us were trying and it was totally in our power, I think we'd see more people successful.
Yeah.
So, yeah, it's tough. But that being said, I think there's some significant things we can do. I know the statistics and the odds are stacked against us. I do think, though, it's not about weight, it's really about health. And there's a lot of things we can do to maintain our health and stay healthy and ward off all the horrible other things that are associated with being overweight, like cancer, cardiovascular disease, and all that. There's ways to be whatever weight you are and be healthy. And I think that's my message about weight loss, is because I am also forever, like all of you, trying to lose weight. More from a health perspective. I think we're all beautiful, gorgeous people. And, I know there's a lot of pressure in magazines and on social media and society to look a certain way. But I love that this new generation of women are coming in all shapes and sizes and colors. And so we're seeing that change in social media.
Hmm.
But, there's still a pressure for all of us uh, I think there's a lot of pressure on women specifically to look and feel a certain way. And I mean, I love that we're getting more open about what that means, but I think we still have a long way to go. I don't know.
Definitely. Yes. What's up, Ortega? Welcome in. We are on a hype train, guys. Thank you for the gifted sub, Savvy. Thanks for the bits, Mom. Thanks for the resub, Betty. Robust Mom said, trying to be healthy as I get older, and it's a challenge. Well, I don't want to get too into it just because we're on a little bit of a time crunch, but especially in America, um, I've been watching a lot of travel YouTube, especially in Asia, and they have convenience stores, but their grab and go food is so much healthier than ours, and it's like nice ingredients and good. I mean, their 7-Eleven has, fresh sushi every day, fresh fruits and veggies, not, old looking gross things where, all right, am I going to eat this like sandwich or I don't know how long it's been sitting here, or am I going to just grab this bag of potato chips? I'm going to grab the bag of potato chips. Like, let's be real. So yeah, I mean, and we can get into that another time, but it's different in every culture. I mean, different cultures and
Yeah,
countries
cultural
also.
stigma. Yeah, Brady wrote cultural stigma and weight. I mean, there's so many things to talk about with weight, and yes, we need to really re I think the first conversation I have with patients is, what is your goal and what are you trying to achieve with weight loss, and what is really bothering you? Is it you're having knee pain, or you're you know just trying to age more gracefully, or you're trying to prevent, like in my situation, I'm trying to prevent any of the side effects of having weight. Cardiovascular disease, the number one killer in our country is cardiovascular disease. So it is, yes, it would be nice to, I always joke with my patients. I'm like, you know what? I realize I'm never going to look like Salma Hayek. I'm never going to look like these models. I'm never going to, I would love to look like J-Lo. J-Lo's the same age as me, or she's like 1 year older than me. J-Lo has a lot of money to look like that. She has a lot of time to look like that. We're
Yes.
all working people. We're all real people, So yes, it's hard to want to look like that. It's hard to see that and want to look like that. Yeah, I love so but I think there's a lot of successful things you can do to lose weight. And I think finding out what your goal is, what is your primary driving force for losing weight, and then really being realistic about talking to someone with functional medicine. We're going to go into how functional medicine can help with weight loss. I think when we look at all the things that are stacked against us, I think that's where functional medicine can really help. How do we, detox? How do we decrease inflammation? Um,
Hmm.
how do we pick, healthier foods? How do we get movement in our life? How can we test the gut microbiome? Um, so these are things that functional medicine will address that I think from a root cause perspective can help with weight loss.
That's a great segue into our next point is the functional approach to weight loss. I know you spoke a little bit about
Mhm.
some of the things that kind of
Yeah.
involve weight loss from a functional medicine perspective, but really, really quick, guys. Thank you so much for the hype train. Sorry. Um, so what are some things, I guess, that would be incorporated into the functional approach to weight loss?
So, what so we start with what the goal is, and then we look at where people are at right now and what are they willing to make changes in. And I think there is a lifestyle aspect to it as far as diet. We know when we do the research the right now the best diet is a Mediterranean diet. That has always been researched, and that's where we see the best outcomes. So that's that seafood, lots of veggies, some fruit, healthy fruit, berries, um, fish, not a lot of heavy meats, more light meats,
Mhm.
and nuts and olives. These are the best foods for us as far as when we look at research, that's the best diet. Now, I always say we want to find the best diet for an individual. And I think that may be different genetically for one person to another. My
Mhm.
family's from India, and I might be having certain genetics where a certain diet might be better for me than someone from another country. So, and there are lots of, yeah, if you don't like fish, you don't like fish. There's other things that are healthy out there to eat. But then we're not only looking at diet and lifestyle, we're looking at lab tests. And I mentioned some of the things in functional medicine we're looking at. We're looking at inflammation in the body, because when we have inflammation in the body, that means our immune system's activated. Yes, avocados. Your mom's smart. Yes, avocados are part of the Mediterranean diet as well. So uh, we're looking for inflammation. We're looking for uh, liver problems, because if your liver isn't working, you're not able to detox. And
Mm.
when you're not detoxing, that means lots of toxins are building up in your body and cells aren't working as well as they should.
Mhm.
Inflammation means your body is too busy trying to figure out what's going wrong in the body for the cells to work properly. And then we're looking for nutrient deficiencies. So we're looking for nutrients that are missing, because a lot of us think we're eating healthy. Yes, we're eating healthy, but maybe we're not getting the things that we need. And the most important piece might be gut health and really understanding the gut microbiome. There's been research on this is a funny research piece of research that came out. Basically, they took rats that were skinny and they took the bacteria from their gut and they put it into rats that were overweight. And guess what happened to those overweight rats? They got skinny.
Wow.
So the gut microbiome is a really important piece to and we don't quite know exactly what's going on there, but there's something to the gut microbiome that helps with our weight. And we look at sleep. How do we improve sleep? Because a lot of us aren't sleeping, and a lot of research studies say when you sleep, when you don't sleep, you actually gain weight. And it probably has to do with the stress hormone, cortisol.
I was gonna say stress is what I feel like
Yeah.
I see as I've gotten older. It affects just like what I want to eat, when I want to eat. Like, so
Yes.
yes.
When we're stressed, we don't have the same resiliency to picking the right foods, and we tend to overeat.
Mhm.
So, because insulin goes up when stress goes up, and so we get hungry.
Oh.
Yes.
See, I've been finding for me personally, like I get overwhelmed and then I don't eat. And then, like today, not like a bad overwhelm, but I had a lot of things to do. And I was like, ah, I mean, I've talked to you about it before. Like, I'm hungry, but like, I don't have an appetite. And the only, like, I was so close to just like ordering something from DoorDash, like something fast, of course. And I didn't. I ate a peanut butter and jelly sandwich instead, but still, like, I didn't have like that much of an appetite. And then what happens? I'm so hungry, and then it's late at night, and then I eat late, and I feel it the next morning. I'm puffed up. We've talked about it, and it's not a pretty picture. So I can say that I'm definitely dealing with that this now in my mid mid 30s.
Mid 20s. Yeah.
I wish.
No, and you hit it on the nail. Like, our circadian rhythms are really important for weight too. So when
Mhm.
we eat really late, we also don't give the body rest, and
Yeah.
then we we also are increasing our insulin level, and having high insulin levels is related to weight as well. So there's a lot of connection between we see that people who work night shift actually have more medical problems. So
Interesting.
yeah, so that has to do with circadian rhythms and how important they are, and rest, when you get your rest, and that it's in the dark, and then when you rise you see the light. Those are really important for sleep, and that is connected to weight.
Wow. Yeah, I did not know that. See, I learned something. I knew learned something from you all every day.
It's all connected. That's
Yeah.
the hard part. It is about approaching weight loss from a holistic perspective. One thing relates to the other. You can fix your sleep schedule, but if you're not fixing your food and you're not fixing your movement, it gets really tough.
Mm,
So, water is another important thing. Sometimes we're overeating because we're our bodies need water, and we're using food to provide us with water.
interesting.
Oh,
That makes sense.
your mom drinks a lot of water, it looks like, at night. So
She does.
yeah, that's
She
great.
she tries not to eat late. She drinks water instead.
That's
Melo asks, how late is it to eat at night?
typically you don't want to eat after 6. Yeah,
Really?
you want to have a at least a minimum of 12 hours between dinner and breakfast. So if you're eating at 6, so say
Oh,
you wake up at 6, then that's fine. You could eat at 7 and wake up at 7 and eat at 7. But
okay.
typically don't you want at least a 12-hour fast at night. And that's where intermittent fasting, a lot of people have asked questions about intermittent fasting. What are some techniques right now to lose weight? A lot of people lose with intermittent fasting, and the theory behind that is you're lowering your insulin levels by increasing the time between your dinner and your breakfast or your lunch.
Yes.
Ooh,
And
where
guys, that's a good little time to say Millen's been working on some phenomenal TikToks, and she consistently posts almost every single day the most interesting things. If you guys are not on TikTok, she's also on Instagram at Lotus IHN. I need to put this I'll put it in the chat. But we're trying to incorporate more reels and whatnot. Follow, just because there's a lot of interesting things that she kind of goes over, and there's a lot of content from just this month about weight loss, fasting, dieting, a lot of stuff. I'll put it in the chat for you guys to follow. Um,
Brandy wrote that yawning is a sign of thirst. I had no idea.
but
I had no
Brandy, um, Brandy, I wish we could have her come in now, but
idea.
Brandy is what is your, I'm sorry, Brandy, can you remind, are you is she
She's
are you dietitian?
she does an integrative nutrition.
That's what it is.
And she's also uh like a chef. I mean, yeah, integrative
Yes.
nutrition. And she's also like a chef. Oh my gosh, she's cooks amazing things on her. She's on TikTok. She's got amazing creativity is my superpower is her TikTok. Um, but follow you guys should follow her. She's got some amazing tips on food and how to cook things. It's really great.
Yes. It's there's so much, like I said, there's so much information out there. So you got to make sure you guys are following the right people, though.
Yeah. Some people have written some things, and I wanted to address that. Does turmeric really help with inflammation? Yes, absolutely. There's studies on that. There's lots of research around turmeric. I highly recommend turmeric for inflammation, and I take it daily. I like Gaia has a really nice little turmeric powder. You can put it in your tea or coffee. Have a little half a teaspoon every day. That's what I do to make sure I get turmeric in my system. Most Indians, they show in India, turmeric is part of the cooking, and we have literally no Alzheimer's in India. So they do believe that it's related to the turmeric and the food and the spices. So spices have a lot of nutrients in them, a uh, lot of properties to help healing in the body. So definitely add spices to your food.
I need to
Somebody
do
wrote,
that.
I have lupus. Can I be helped? Savvy D wrote, and please say yes, absolutely yes. Lupus can be helped with functional medicine. I definitely have patients who have rheumatoid arthritis, lupus, osteoarthritis, any kind of inflammatory disease can be significantly helped with functional medicine. And then I see Ortega 1313 wrote, he was once told by a Chinese man to drink lemon juice and garlic on an empty stomach before I go to bed. Yes, I have heard this too. My grandma does it. My grandma used to do this, and she
Wow.
used to teach me to do this. She used to say, as soon as you wake up, drink a glass of lemon water, and um, it will cut your hunger. What I think is happening, honestly, is lemon is great for adding vitamin C and adds to acidity. And as we age, we actually have um, problems with digesting our food. We don't have enough stomach acid. In fact, everybody's getting put on you know, antacids and everything like that. And the problem with that is we don't have enough acid to digest food. And so then we're not getting the nutrients we need. And so then we're getting more hungry because our body's saying, hey, I need some food and I need these nutrients. What happened? You didn't eat them. Well, you ate them, but you didn't digest them very well. And so they weren't getting absorbed. So I've
Interesting.
the lemon thing is really coming from the perspective of aiding in digestion. And so I love the idea of lemon water. And I'm so glad that Ortega brought it up. And I think I need to go back to adding that to my regimen because I do it every once in a while and then I stop. So I like the lemon water. And yes, your mom's gonna
I
mark
I
it up.
do the like I do at least 10 ounces first thing in the morning of just water, but I'm gonna start. I got plenty of lemons. I'm gonna cut them up, add them in. Um, so yeah, well, thank you for addressing those questions. Yes, we are seeing your guys' comments. Thank you for being so patient. And I just want to remind you guys that we do have our website here. If you go to our website, which is lotusintegrativehealth.com, there are options for complimentary discovery calls. There's a lot of information about functional medicine and everything that our practice does. But you just go to the website and then I'll put the Instagram also on here so you guys can follow. We're doing so well on our TikTok. We got to up our Instagram.
Yes,
So
definitely.
a lot of work and a lot of thought in all of the social media, which is it's very helpful. It's free advice pretty much, but obviously it's according to every person, every individual is different, and of course, it's just for educational purposes. But some really great stuff. Yes, and follow creativity is my superpower. Also, please. So did we get to go over everything as far as Oh, so I kind of wanted to bring something up
Yeah.
because what I see a lot on social media, especially like girls or ladies my age and younger, is there was like the big fad about like the slim teas. And then now I'm seeing like the colon cleanse. Like people are trying to take these like what is your I guess what do you have to say about those kind of things? Like I mean, obviously, like things like that, they just seem too good to be true. But I mean, is there any like scientific thing behind it? Is it just giving you diarrhea so that like you lose water weight? Like, what is it? What is it? I remember like it used to be the unfortunately, me growing up and seeing like shows and stuff about like teenagers like the X-lax and water thing before prom to fit in their prom dresses and this and that. Is it pretty much the same
Temporary.
thing?
Yeah. It's temporary weight loss, really mostly water weight. Um, Not really anything long term, obviously. And
Mhm.
yeah, if you're Kim Kardashian and you have to get into the Marilyn Monroe dress, then you do whatever it takes, right?
Right.
In fact, there's some theories that she took, and I was going to talk about this pill called semaglutide. I don't know
Mhm.
what she did, honestly, so don't quote me on it. Don't want to get in trouble with her. But, I have no idea what she did. Good for her. She got into Marilyn Monroe's dress, and she looked beautiful in it. The new kid on the market for weight loss is the Ozempic and the Wegovy. You're seeing the ads all over TV, and you know, I think from a yes, you can do all the other stuff that we talk about, but for people who are really struggling and want a little help, I think these medicines can be really helpful for people who are overweight, significantly overweight, and of course their diabetes medications.
I
And
was just gonna say, I the most recent article or post I had read about it was that it's for type 2 diabetes. Is that correct?
it's for type 2 diabetes. It is, you know, it is helping with insulin. Basically, it's increasing insulin sensitivity. Um, so that's why it's used for diabetes. The nice thing is we're seeing significant amounts of weight loss after taking that.
Hmm.
And the reason you're seeing the weight loss is that's activate it works a little different than other diabetes medications, that it's working on adipose tissue, it's working on your fat cells to increase um, the burning of the fat, it's increasing release of sugar, it's helping the liver, it's helping the fat cells, it's helping the muscles, it's working on your stomach so that you're processing food a little slower, which might be good for some of us. Some of us might be really fast digestive people, we're just running through food really quickly, might slow things down a little bit, improve absorption. And most importantly, it's increasing satiety, which means that you feel full, and you don't feel hunger. It works on leptin and ghrelin. These are hormones that are really important to when you're hunger, feeling hangry, and whether you feel full or not. And so, yes, you can take it if you're non-diabetic, but right now the FDA has approved it for significantly overweight people. It's not for losing 5 pounds. It's really for people who are significantly overweight. So it is a great, it's something that's helpful. Unfortunately, right now the studies show if you use it and you stop, you gain all your weight back.
That was gonna be my next question. I'm sure it probably requires a change in lifestyle, diet, an additional diet, additional exercise. I think people are just still wanting the one thing that
Magic
will
pill.
fix it fast, and that's it.
Yeah.
But I think that um, you also have to change other parts of your lifestyle. You can't just take the pill and whatnot. I mean, I remember when diet pills were like on TV all the time. Like there was a time where, like, sorry, mom, like I was taking them and they probably messed up my anxiety. That's probably why like I have such bad anxiety still. But it was the thing to do. Like the young girls that I was working with were doing it and it was horrible. I felt horrible. It was not the way to go. It was not worth it. It
Most
just
of those
no.
pills are oh my god, I'm just phentermine and amphetamines. They're like boost your metabolism. They're like
Mhm.
stimulants. They're not
Yes.
healthy. Yeah, they're not healthy. Your mom
Yes.
said
I
they're
was
they're really not great for our systems. They increase, like you did said, they increase anxiety. I tried one called Ma Wong, which is I think very similar. I did it when I was very young, in grad school, and I just was an emotional mess.
yeah.
And I did it right before a clinical. I had to go to a clinical test. I had to go through a sort of a test,
Mhm.
about what I did and the with a patient. And I wasn't with a patient, but I was had to do a simulation, and I was just an emotional mess because
Yeah.
it hits your brain, it stimulates your brain, it not only stimulates your metabolism. And that's the great thing about this medicine, it doesn't really affect the brain. It really is working on all those other well, it affects the brain with the satiety and appetite, but it doesn't affect the brain as a stimulant.
I
So,
see.
yeah. So, and that's where you're talking about teas and things like that. Yeah, fen was huge. Yeah.
Hi,
Somebody
Nina.
Norma said, "I missed the fen-phen." Fen-phen, people lost a lot of weight with fen-phen. That was phentermine and also another amphetamine. So people lost a lot of weight with that, but it was really dangerous because it stimulated the heart, and that's why it was
Yes.
off the market. So
I
we had
see.
some deaths with it. It was a cardiac stimulant. So
So this medication, so this is actually a medication that is for diabetic, but it's
it's
being
working on
used
sugar.
for weight
Yes.
loss. I
Yeah,
see.
it works on insulin and it works on it's a different kind of medicine that works in many different areas. And I
Okay.
think it really hits those it's really great for those people who have the issue with being hungry all the time and not having that control over their satiety. I think this is a great medicine for that. And that's why it's being used. I mean, we're seeing a lot of celebrities using it, seeing a lot of significant weight loss in people. Again, you may need to use it and you may have to use it long term to keep the weight off. Um,
Oh,
but
okay.
but I do think there's ways to probably use it um, maybe on a lower level in combination with lifestyle and all the other functional approach we have, where maybe we could see people come off of it once they've made enough changes to their total health.
I see.
So that's my it can be used long term. They're saying it's actually quite safe to use long term. Uh, the Ozempic, Wegovy, Rybelsus. Only issue is for people who have a certain type of thyroid carcinoma. They should not be on it. I guess it has some effect on the thyroid. So
And
um,
it has to be prescribed.
it has to
So
be
it
prescribed.
would be something where you would have to
You have to
discuss
get
it
the
with
right.
your doctor.
Yeah,
Yeah.
and it's not being covered because let's face it, they're making a lot of money off of this medicine, so it's not being covered
Mhm.
for everyone either. And insurances are some of them are covering it. They are covering it for diabetics, but I think the whole weight loss thing, I mean, if 55% of this country is trying to lose weight, we're going to see, yep, there's a shortage. 50,
Yeah.
55% of this country is going to want to be on this drug. And so they're definitely amping it up.
Interesting.
There should not be an effect on the liver as far as liver damage. I think more it's going to act on the insulin, how the liver stores glucose. And yes, they just approved it in teens too, Brandy. So it is safe for teenage. They've just approved it for obese teenagers. Um,
Interesting.
yeah, because of the ramifications for seeing teens who are really. Somebody wrote,
Oh,
yeah.
so Norma said my very wealthy friend paid for it. She's lost a lot of weight. Yeah. And that's the thing. But is it affecting the need for it for people with actual diabetes though?
I don't I, I think that is a hype. I've called the pharmacy. They have the medicine for the diabetics.
I see.
The pharmaceutical industry has to increase the production of this medicine, obviously.
Mhm. Mhm.
Um, so it and let's face it, if you're overweight and need to lose weight, you're on your way to getting diabetes anyway.
I
So
see.
most of us who are, I mean, all of us who are overweight have an issue with glucose and insulin and
Mhm.
are likely pre-diabetic if you're not diabetic already. So,
I
um,
see.
if anything, I think there's a lot of backlash against overweight people that, oh, all the diabetics can't get their medication. I think that's, I think it's not right because folks who are overweight also need medication to prevent a lot of disease, right? So, Um,
Interesting. I was wondering about that. That was another thing I read. I was like, oh,
Yeah, there's a lot of backlash against it. I think the real backlash should be against the people who need to lose 5 pounds and, are using this drug to lose, or using this drug as a sort of by the way. But,
yeah,
again, all of us have our own individual medical problems. And I don't think we should judge anybody else for going and getting a medicine that might help their health. So,
right.
overall we don't, it's just out. We don't know enough about it yet, but it looks very promising, and I do think for most people it would work really well. And it's something to look into, and it's definitely very popular, and I do think it's going to get more popular. Um, so that is, yeah, I think that's something that, so I really want to incorporate using semaglutide for patients with the functional medicine model, so that people are getting the holistic approach. It's not just about popping a pill and losing weight. It's really about
Mhm.
having some long-term benefit and having weight loss that's going to be significant for the long run, not just for the short run.
Yeah, because yeah, I can't imagine it just being the pill and that's it.
Yeah.
Unless you're taking the pill literally forever.
Yeah.
Normal.
Well,
You should have put on the Christmas wish list.
probably going to be on a lot of people's Christmas wish list. I'm not even
Well,
sure how much it costs. Actually, we should probably call up the pharmacy. That might have to be on your Trello board for this week. Just call up the pharmacy and see how much it costs for cash. I'm sure it's
right, right. All right. Well, it looks like we kind of covered what we wanted to as far as a functional approach to weight loss. Um, let's go ahead and move on to, I guess, things that are still working, that are not a pill. That things that work uh for your journey to close to teeth. Well, that's my concern. I'm like, well, like, I think what I would hope is that people will educate themselves and understand that you do need it to be prescribed to you, and it does need to be done in a safe manner.
yeah.
But yeah, so I mean, I guess back to the basics as far as what you would recommend, the things, things that do work.
I,
I know
you know,
you and I have spoke about how my eating schedule is horrible. I think I'm definitely gaining a bit of weight because of that. And that's just because I need to literally set an alarm on my phone and eat at the right time, and having the munchies don't help either. But, what are some things that are, we're still using to lose weight besides,
I
telling
mean,
ourselves that we want to lose and not doing anything about it?
yeah, I mean, I think there's a lot of habits that really promote healthy weight, and research proves that they do. You know, um, I think there's been a eating breakfast is a little controversial. Research shows that if you eat breakfast, that you will um, improve your weight. I think it depends. I really think some people benefit by not eating breakfast. I think figuring it out what's good for you is important, but overall, eating breakfast is considered important. Um, Sleep. We talked about sleep. How important is sleep when we see uh, research shows that people who don't sleep well gain weight? That helps. Sleep is regenerative for us. It's really important to prevent aging, prevent weight gain. Sleep is so important. I think if I'm going to work on one thing with a patient, it's going to be sleep, because sleep will help with stress. Sleep will help with your circadian rhythms. Sleep will help with your weight. Sleep is so important. Um, some other things that prove to help is weighing yourself weekly, because then you're conscious of what your weight is. And if you're gaining weight, then you will be conscious of your food intake. Um, Moving. keep moving throughout the day. And, exercise every day is important, but then moving throughout the day is important too. If you're exercising for 1 hour and then you're sitting for the rest of the day, that's no good either. And so
Yeah.
when we see cultures where people are, and we'll talk about it in a minute, there's certain areas of the world where we see people have really good health, and those are called the blue zones. And when you look at people in the blue
Mhm.
zones, they tend to move. They are moving all the time. I think there's these older Okinawans in Japan, and even the elderly are collecting leaves and working and moving around in the forest. um, I think watching your food is always great. I think, if you can eat organic, great, or at least look at the Dirty Dozen or the Clean 15. Pick those foods that are the most healthy, eat less processed foods, eat less carbohydrates, more vegetables. Those are definitely going to help you. And then the most important thing is stress. And I think you and I were talking about stress. I mean,
Mm.
last year was probably one of the most stressful years I've had in a while, and I gained a lot of weight last year. I wasn't sleeping properly, but more important, I had a lot going on in my house. And I think that is our number one killer is stress. We take on too much, the way our society is functioning, and we don't have enough downtime. And meditation and mindfulness is really a great way to combat stress. When we look at the data, people who do meditation, who even a shavasana, and we have a handout that you made for our patients on shavasana. The data on shavasana, I mean, just laying there and closing your eyes, it improves your blood pressure, improves your stress, I mean, you name all the benefits of just lying somewhere for 15 minutes and being quiet. And so that is like one of the other, if I can't work on sleep, I would love to work on stress with people. How do you decrease stress in your life? And decreasing stress in your life is not, everybody's stressed out. We all have stuff going on. It's
Right.
how do we perceive our stress? How do we change the way we react to the stress around us?
Yes, Norma said more sleep, more movement, and less stress. Yes. I mean, and maybe that's a reason why, like, a lot of Americans are overweight. Like, our work ethic and whatnot is just, we stress ourselves out so much. That's interesting that you had mentioned what is it called?
The blue zones,
The
yeah.
blue zones. I just was learning about that because I follow this couple. The wife is American. The husband is American, but was raised and is more Italian culture wise, and they live so much longer.
Yep.
Certain places in the world they do because they don't stress out as much.
They don't
I'm
stress.
sure places like that take the siestas they probably live longer and healthier than us. I'm assuming, but we should definitely do another stream on that, the meditation and the relaxation and all that, because I know you and I are definitely on the same page as that. Even though I need to do it more, I need to get back on my meditation so bad. Um, but do you have any? We're a little over time. I don't want to keep you for too long. But do you have any other last words about this topic specifically?
I think I don't want people to lose hope. I think it's important to work on your health. We want to minimize risk for, sort of heart disease and cancer and things that
Mhm.
are really big killers in the United States. And I think there's nothing wrong with being whatever weight you are, as long as you're the healthiest you can be. And so, yes, we would all love to, lose weight. And yes, I think Brandy's saying it. Let's just embrace our Baroque bodies. I mean, we would be considered a goddess. Where's my toga? I think there's some self acceptance, but I also think there's nothing wrong with trying to be the best self, best.
Mhm.
That's sort of our motto. at Lotus Integrative Health and Nursing. It's just like be your best self, what
Mhm.
is that? And pick what that is. I mean, we don't all have to be we're not going to be Selma Hayek or J Lo, but we can be the best Milan Chavarker and Amanda Robles we can be, right? I mean, and that's what I'm here to help people get there. If we're get where they want to go. It doesn't have to be where everybody else wants you to be.
Oh, I love that. Um, I love that a lot. So as I said, you guys, I put our Instagram in the chat. And from our Instagram, you can pretty much find everything on our from the links in our bio. It's gonna have our website. It's gonna have a link to schedule a discovery call if you're interested in speaking to Milan about possibly getting on a program with us. And there's just a lot of great information that we share on there. Um, Milan reflects on some articles that that she comes across, and it's just a lot of thoughts in everything that we post. So give us a follow. I think our goal needs to be that we get to 1,000 followers on Instagram this year.
Yeah.
We're close on TikTok. We're gonna get there on TikTok for sure. And she's also on Facebook. We do have some private groups that we have that if you would like to join, just I mean, you're more than welcome to hit my DMs, but follow us on Instagram. That's probably going to be like the easiest way to, I guess, get all of our information the fastest, or the website, which is right here. I'll put up. And there's some great information on there. But yeah. Well, thank you so much for joining me. I had so much fun.
Thank you.
Hopefully, we can do this again soon.
Yeah, I think this was good. It's been like a year since we did this, so it's great that we did it today. I love it.